Hi guys, this is Brandy. I am 4 weeks, almost tomorrow I'll be 4 weeks post-op from my Acdf surgery, C5 through 7. And I still have like this feeling of like something stuck in my throat. So my swallow is still good and everything like that, but like I can't shake that feeling, and sometimes it makes it a little bit hard for me to like breathe when I'm talking. So not all the time, but today for some reason it's causing me more trouble than usual. But I'll talk to my surgeon about that later. It's really not that big of a problem right now for me. Anyway, so today, this video, I got out of the shower and I thought, well, maybe people want to know about like the shower routine or how to get ready after you have the Acdf surgery. So like for me, I was told that I can shower and like wash, shampoo my hair and everything and wash my incision from day one. So like the next day that I came home from surgery, I took a shower and I like washed my hair and everything, which honestly is a little bit weird because I'm used to tipping my head back in the shower to rinse it out, and I couldn't do that. So that was different, but I was able to like stand on my own and everything like that. So this is how it looks today. I think it looks pretty good. Like all the stitches are dissolved and they're not raised, they're not irritated. So it feels pretty good. They said that the outside stitches dissolve in 3 to 4 weeks and the inside stitches dissolve in about 6 weeks. So still got some time on those ones, but anyway, so I'll kind of show you. I got a shower chair before surgery because I was so afraid like that I wouldn't be able to stand up. I just got that on Amazon. Wanted to make sure it had a back and handles, and so that's the one I went with, but I don't need it at all. So, but it does help me now when I lift my leg, when I have to put my foot up on something to shave my legs. So that's kind of difficult, but I've gotten used to, washing my hair and everything without having to tip my head back. So that was the most challenging part of taking a shower. Okay, so I wanted to show you, oh, and also one more thing. When I brush my teeth, now I've encountered a situation with like rinsing my mouth. I'm used to, it's my sink, I'm the only one who uses it, so I'm used to just kind of putting my head under the faucet and like getting the water to rinse my mouth out. And I can't do that anymore, so now I just cup my hands and bring it to my mouth, and that's worked out fine, but other people might prefer to use like a cup or something like that. So just little things to get used to when you can no longer bend your neck for a while. I don't have my Aspen collar on right now. So with, just like with the Aspen collar, there are different kinds of neck braces, neck collars. This is just one of the kinds. This is the kind that my surgeon's office uses, but there's different kinds. And just like there's different kind of neck braces, there's different kinds of bone fusers out there. I talked to my neighbor, she had a whole bunch of bone fusions done, and she said that she didn't use any kind of bone fuser, but it was a long time ago that she had hers done. So it's supposed to help speed up the process. It like sends currents back and forth to each other. You put the electrodes on both sides of your neck. At least for me, that's what mine does. And it's called Biomet, Osteobiologics. And it's by a company called Zimmer Biomet. So it's a spinal pack. It's a spine fusion stimulator system. So they gave me this like pack, and inside of it I have all my supplies. But really, they just store my electrodes and my stickers in my bag. So this is like the charging system, and it comes with 2 batteries. And so I keep it plugged in at all times, and I always have a battery charging up. And then it comes with individual packets, and my supplier, my representative from the company, they came out to my house to teach me how to use it. But they will send me these as needed. So they sent me a whole bunch already, and so I'm good for a while. And I'm assuming that they keep up on when I need refills, and they'll call me and ask if I do. And if I see I start running low, then I'll call them first. So I open the package and I take out my electrodes, and it's supposed to help stimulate the fusing of bone growth, basically, between the vertebrae that had the cages implanted into them, where they had the discs removed and then cages implanted there. So she taught me to put them like kind of like under my earlobe as a guide. Put one low on one side, and then put the other one a little bit higher on the other side. Now I will say I've noticed that like between the collar, the electrodes, and the stickers that I put on over the electrodes, it's making my neck break out, but that's okay. So anyway, the stickers come like this together. I cut them in half because I noticed that when I sweat, where my skin gets oily, these electrodes slide down. Otherwise, they're pretty strong and they stay pretty well until I start getting oily skin. And I have pretty oily skin. So, let's see. I'm trying to do this with the camera, but I feel like I can't see as well as I need to. So I'll put like half over it, and it helps it stick better. And I am allergic to latex, but these stickers and the electrodes don't bother me at all. So maybe there is no latex product in them at all. My skin's very sensitive to like Band-Aids and stuff like that. So these work well for me. Okay, so I have the stickers on over them, and that just helps them stay put. No more sliding off. Now, my battery is like 1 bar low. I'm gonna go ahead and swap it out. It's blinking because it means it's not plugged in. And I have it on mute right now so that you're not hearing the alarm. Because if it senses a disconnect, then it has an alarm to alert me that it's disconnected, so that I can put it back, connect it back together. So this is my belt clip part. It clips onto my belt or like the top of my pants, and then it just slides right in. So I'll go ahead and put that on the top of my pants and get it ready. The back of it just pops off. The battery just pops out. Like that. And then, so I'll take this thing, pop the charged battery out, put the uncharged battery in. So that orange light means it's charging. Then I'll go ahead and I'll stick, there's like these prongs right here, and I have to match these up to it. Click it in, push start. There we go. You can see it's fully charged, not plugged in, and the alarm's going off letting me know it's not plugged in. So I'll put it on my belt clip. Let me plug it in. And then it stops beeping. So it's very easy, and I don't feel a thing. So I look like Frankenstein with this and these wires coming out of me and everything, but I don't feel anything. It really doesn't bother me. So it's light enough. I even sleep with it on. So like, but I sleep on my back mostly, or my side. But you're not supposed to like put your knee all the way over to where you're kind of laying on your belly a little bit. You're supposed to have like a pillow in between your legs if you sleep on your side, and avoid putting your arm under your pillow that's under your head. So like there's some little differences that I have to use, which it's been fine so far, but pretty soon, starting tomorrow, I may have to start putting Benjamin to sleep and my 1-year-old, and that requires laying down with him and rubbing his back until he falls asleep. But up until now, for this entire month, my husband's been off work, so he's been doing that for me. And I'll probably wear my neck brace during that time because I don't want to lay down with the baby. He's kind of rough and he's hard to get down to sleep. So I just want to make sure that I'm protected. So what else? I guess that's about it. I've covered the shampooing is a little bit different. To rinse it out is kind of harder because you can't tip your head back. Just rinsing my toothpaste out of my mouth is a little bit different. I have to cut my hands, bring the water to my mouth. Now, what else? Bone fusor. I guess that's about it. So I was able to shower on my own starting the very next day after surgery. I don't know if everyone's the same way. I thought I was going to need my husband's help, but I never did. And things have been going pretty well so far. So if you have any other questions, like I said, there's all kinds of different bone fusing machines out there. I know some people wear this thing that kind of looks like a headset that goes around their neck, and it's like a plastic one piece. I've seen that. But mine is just simple little wires that I don't really feel, and I wear it 24/7. And I'll probably wear it for the full 3 months, at least, depending on the fusion and how it goes. So I guess probably in about 2 weeks now, 2.5 weeks, I'll find out, I'll get another x-ray and see how things look. So I'll see, I'll hopefully see if I can get a copy of the x-ray film myself, because I just like to have those. I think they're like my trophy or something. But anyways, yeah, so I have not been wearing any makeup. I do my best to wear comfortable clothes as much as possible. My hair is soaking wet right now. Oh, and one more thing. It's challenging to dry my hair because I have long hair, used to tipping my entire head upside down and then wrapping my head in a towel and then flipping it back up and letting it dry for, in the towel for a while before I brush it and everything. But I can't do that anymore. So I just have to wring it out the best I can. And I've noticed like a lot of dripping water coming out of my hair, and it's really annoying, but at least it's clean. So I'm finding that I can just let go of some of my OCD regular habits for now. So it's actually kind of freeing. But anyways, if you have any questions, just comment below and let me know. Thanks.